I thought that the ambulance, because I saw them even there today, I thought they still had the base station by the hospice, by hospice.
They do.
They do?
Yeah, I thought they might be there, but I know they have that also, they have the station up in there. And there's always, I've seen cases on the rear. I mean, even if they're taking somebody down, they're back up to the side.
Yeah. And how many rates can you keep up here?
I've seen when I go by, it seems like there's two stations. And I don't know if that's a share change or what, but it seems consistent.
I like that.
And I don't know how many is in there. Have you ever seen how many is at the cancer center there?
Cancer.
Yeah. Not the cancer center, the hospital.
Oh, hospice. One is usually what I always see.
Always one, yeah. And I think the cancer center building. But again, I was down
One second, I'm going to do a test for the folks online. Good evening. This is a test for those on our Teams call. Can you let me know if you can hear us? Good evening. This is a test. Can you hear us on our Teams call? Can someone give me a thumbs up or? Okay.
You're testing Teams? Yes. Okay, I just sent Bill Martin, I know he's on, so, you know.
Okay, I'm changing the audio settings.
Good evening. This is a test on the Teams call. Can you let us know if you can hear us? Good evening. This is a test for those on our Teams call. Can you hear us? Good evening. Can you hear us?
Colette, can you put out a written asking if they can hear?
Oh, Dave said you can, yes.
Yeah, I guess so.
Okay, yes.
All right. Maybe they can unmute themselves. Okay, sorry about that.
Isn't technology wonderful?
Well, good evening, everybody. Thank you for coming. We really appreciate it. I don't have to tell you, this is one of the biggest things that faces our community now is healthcare. So we're going to have our two consultants joining us, and what they're going to do is basically be listening to our input on what we feel we need. They're going to compile this information, and when it's all done in several months, we'll have another one of these meetings, and we'll share with what conclusions they came up with. And kind of in a sake of time, when you're asking questions, if you hear, the same question over and over, please keep it short, as I know everybody's big ask is going to be, we need a hospital, and I agree, we absolutely do. But if somebody gives a presentation on it and you agree, if you just come up and say, yeah, I agree, we need a hospital, that would be appreciated. We're not going to go down the road of the healthcare that we have right now and that we need more, because we all know we do. And so we're just going to focus on what we need in the future. And so with that being said, I'm Steve Crowder. I'm one of the ad hoc committee, the healthcare committee, and this is Ron Lasan, who's the second council member of the ad hoc committee. And Ron?
Yeah, again, we've been talking to folks for quite a while about the healthcare needs. We know it's an important topic to most folks. We know that there are a lot of seniors that won't come back unless there's an emergency room, okay? We get that. What we don't have is a collection of facts that we can take around to the different healthcare providers and say, this is what we need and this is what our residents are telling us. And so that's what the purpose of that study is. That's the purpose of this meeting, is we want to hear from you as the Healthcare Study Committee has gone out and surveyed folks, and they will continue to do that, to gather those facts so we can show with specifics what is it we have, what is it we need now, and what is it we need in the future as we grow to a larger community. So that's what this is. It's just a point in time, so you won't get solid answers. Oh, yeah, there'll be a hospital on this date or anything. We don't have that answer. What we have is a whole lot of questions, and we're asking you to help us define some of those parameters around those questions, that we can make sure that we uncover them and take those facts to the healthcare providers, whoever they be, to see what we can get going in the future. With that, I'll turn it over to Colette.
Great. Thank you, council members. Again, thank you so much for being here, both here in person and online. So our staff here was given direction by our council to hire a consultant who is objective, who can go through this process to gather information from many different sources, whether it's regional studies, local studies, our area hospitals, our area health providers, doctors, and as well as stakeholders within this community and the public, to gather all of that information to look at what was our healthcare situation before the fire, what is it now, what should a community of our size expect in the healthcare realm, and what are those gaps? And then, given what those gaps are, how do we fill those gaps? What is a strategic plan to fill those gaps? This study is going to be an objective look at that information that we can use, as the council member said, to speak with healthcare providers to fill those gaps in the future. It's really important for us to gather this data, and so we have a wonderful consultant working with us that has extensive experience. They are full of doctors who have worked in this field in hospital management, who are very familiar with this type of endeavor, and we have them here on the line. I want to introduce Dr. David Ghilarducci, who is here with our consultant group. He has been working steadfastly for the last few months, and I actually want to give a moment to David to talk a little bit about the work that you've done so far. Oh.
Can't hear you yet.
Oh, shoot. Let's see here. Hold on, David. I don't think we can hear you. I'm so sorry.
No problem.
There we go. All right. Go ahead. Yep.
Great. Well, thank you so much for having us. And I see my partner, Bill Bullard, is on as well.
Great.
He's the president of the company. And so just to briefly tell you a little bit about ourselves, I'm Dr. Dave Ghilarducci. I'm actually trained as an emergency physician. Before that, I was 16 years in the fire service in Santa Clara County. And in the 25 years working both as an emergency doctor, a health officer, and most importantly, an EMS medical director for 3 different counties. So I've been doing this for over 40 years. And Bill, if you want to briefly introduce yourself as well.
Sure. Thanks, Dr. Gillanucci. My name is Bill Bullard, and I've spent about 40 years in EMS and healthcare services, and had an opportunity to work with different cities and counties as they look to identify their and underserved populations and how to improve upon those including San Diego County, Marin County, and that's what enticed us to your project. I also volunteer in my community in Sonoma County as fire chief, and so I have a strong connection to Paradise and what you went through from the smaller event that happened to our folks and what we went through. So just wanted to give it back a little bit. So thank you for having us.
Wonderful. Thank you so much. And so now, tonight, we are really looking for your input. That is a very important part of this study. As I said, they've been gathering a lot of data, analyzing our situation here, and then also making some projections based on our population and the way we're growing. We're not growing in the same way as a normal city, and so it's really important to take that into consideration as we're planning for the future in what our population will look like in 5, 10, 15 years. So it's really important to us to hear from you all here and online what those priorities are for you. So now that's really all we have to present. So we want to hear from you, and we'll start with those in the room. And if you'd like to say something, I assume you do because you're here. If you just raise your hand, we'll call on you to come up to the podium, speak into the microphone, and tell us what you think. And this is kind of a prompt for you. Of course, you can tell us, kind of what you're thinking about. But this is a good way to think about really the question that we're asking, which is, given your experience with the current healthcare landscape in Paradise, what are your priorities for the next 5, 10, 15 years? So with that, please, whoever would like to speak, please raise your hand and we'll get going. Oops. Okay. Sorry, we're just going to share this.
Break the ice for us.
Yes, I will. Is this on? Okay.
Yes.
Hi, my name is Kristen. I've lived here since I was 6, and I have 2 comments, or I think 2 things that might address that. One is on Saturday night, my 2 children had a little issue, and one of them had to go to the ER to get stitches. And it occurred to me, I wonder if the consultants have access to data that shows how many Paradise residents use those facilities outside of the town, not just on off times like at 2 o'clock in the morning, but just in general when we go to other places in Chico or Oroville or other surrounding communities for healthcare needs. My children also visit PMG Pediatrics that went from Paradise to Chico, and they've stayed in Chico, and so we've stayed with our pediatrician all these years as well. So I don't know if there's a way for them to get access, not to personal information per se, but just numbers of people that come from the Ridge and Upper Ridge communities that are using those services elsewhere. And then secondly, to kind of go along with that, last year the school board presented that the highest growing number of residents in this community are the age 27 to 42, and we're seeing that with the school being so crowded, especially the current Paradise Ridge School, and being at 500 students right now, kind of at capacity. And so I think to sort of address the next 5, 10, or 15 years, if that still is a very high growing group of residents coming, they have children, and the school is kind of showing that that is a need. I think that families need more care for their kids, just so that way they can have something more locally that's more accessible to them and not having to drive to other places like Chico. Even though we love our pediatrician, it would be nice to have those things more local. So just curious if they can get access to that data sort of anonymously, but then also the need that we have for younger families, for people that have kids.
Thank you.
Thank you.
Well, I know the utilization aspect there, is one of the things they're definitely working on. So, thank you.
Yeah, having gone to the emergency room down in Chico, I know it's a 6-hour wait if you have even a significant problem. Heart attacks, you get in right away, but anything less than that, 6 hours is probably an average time. It may be longer now, but it's been a while since I've been down there for the ER. So we get that. We understand the need for it up here. We're looking for other things besides the emergency room itself.
That was the data.
Yeah, I understand. Data for the service down there, yes.
The younger children.
And younger children, for sure. I've got a granddaughter goes to the elementary school, so they added to the population in July of this year. So I get the fact that the kids are growing in Paradise Elementary, so we've got a need for that. I'm sure our guys folks have captured that information. Thank you for bringing that up. Okay, who's next?
And Brooke, you can do it.
Come on up.
Hi, my name is Janet, and I lived here for 26 years before the fire, moved away and came back, and have been in my house that I've just rebuilt. And glad to be back here, very much so that the medical issues here and not having an emergency room or an ER. And I often wonder, and I'm sure that they researched this, of maybe reaching out to like a Sutter Health or other government agencies that can put money in here or have an opportunity to have newly graduated physicians, an incentive to bring them up here for care, that we could have more doctors for the people that are up here while they are trying to plan out what they're going to do in regards to the hospital. Yes, we are growing. We've got many, many more children that are coming up here. And yes, the elderly people won't come back unless you have something for them. That is something that bothers me, that there isn't something here that we need right away, because oftentimes, as you know, we don't have oftentimes a physician at the rapid care up here, and then they just close the whole thing down. And that's, I just maybe thought they could reach out to different areas, different government programs, which I'm sure you all have. But I feel if you build it, they will come, the old saying. So those are my issues. I'm hoping that they can do some sort of research or some sort of reaching out to get new physicians in here, young, whatever, to start their practice, So that's it.
Great, thank you. Next.
Good evening. I'm Kim Morris. So just making little notes here. I think the ER is the most important thing, of course. I think we need robust specialties, the ability to get timely care, which is lacking in Butte County at this point, and some consistent providers. We have a revolving door. And so if you ask me who my provider is, I may not be able to tell you. 5, 10, 15 years, it occurs to me. When I came here, I was 30-something years old. Now, that's been a long time ago. And now I am looking at elderly years. And the reality is that as you get older, going to the doctor becomes your hobby. I mean, that's all you do is you go from one appointment to the next appointment. And going to Chico for that is okay, but it's not optimal. And we need that support for our growing community. Thank you.
Thank you, Kim. Don't be shy.
Sorry, I'm a little nervous.
Don't be, don't be at all.
My name is Nancy. I've lived in Paradise since 1971. I have been an employee, had been an employee at Feather River Hospital for 47 years. I emphatically ask that we get an ER. In my mind, I go over, we have the urgent care. For years there, I've gone in there, there's a big vacant area, that was their pharmacy. Feather River Hospital, when I was employed there in 1973, was a 2-bed ER, and we took care of this community. If
if they could open a facility in that pharmacy area that could have a triage area, it could have the 2 beds that we need. Patients could be, they could have a triage nurse. They could say, nope, you don't need ER, you go to urgent care. This community needs emergency care services. Personal experiences, we've gone to urgent care with an emergency and an ambulance was called. They could not provide the care there. I'm just really hopeful that can happen. Robert was a prior employee of Feather River Hospital. We've stayed in touch with a lot of our physicians, a lot of our colleagues. Many people would come back here in a minute and provide care. I'm retired now. I still have an active license. I would provide volunteer services. I know Robert would help too. And Susan, you better too. But please, please, we've got some really good primary care doctors here. It would be nice to see some dental that is just not through the clinic. Let people, I think we have one dentist, but if your insurance doesn't work with them, you don't get in. And I know we could get physicians back. So I'm hopeful these people are listening to us. And I thank you guys because we can't do this by ourselves.
Well, we thank you for coming up and speaking so eloquently on the needs. We can't do it without you folks.
Thank you.
Okay. It's a team approach.
Well, and that's who we're doing it for, is for the community. And we're all in this together.
I have so much to say, so I'm going to have to taper it. I've been talking to a lot of these people for months. I've been talking to Steve for months. I'm Susan Copeland. I live in Magalia right now, right before you cross the dam. And my husband's a lifelong resident of Paradise. His dad was born and raised here. He was born in Reinigen's Hospital. So for those of you that have been here a long time, that was prior to Feather River. And I don't even know how to sort out my feelings here. I worked for Feather River for close to 20 years. I was an LVN. I worked at a lot of ancillary departments doing home health. I did hospice, and I worked at the clinic for 10 years when it was at Canyon View behind the hospital, and then we got the new building and I worked there. After that, I went on to hospice. One of the things I'm feeling, and I'm getting older too, I'm becoming the senior that has to think about hospitalization. I had an experience last year where I got a UTI. It was on St. Patrick's Day of all days. And I went to the urgent care down there and they were closed. It was probably about 4:30 in the afternoon. So then I went down to prompt care in Enloe. They were just overwhelmed and they were getting ready to close. So I ended up having to go to Enloe for a UTI. For anybody that doesn't know, that's a urinary tract infection, which pretty minor, but I had to go sit in the ER on St. Patrick's Day, wait to get in and be seen. And then I'm driving home to Magalia at 3 o'clock in the morning after my appointment. So access to care is huge up here. Yesterday we had an accident on the Skyway. People were having to go down Neal Road, and I have friends that were going to the doctor, and they were in a panic because it was bumper to bumper getting out of town to get to their doctor's appointment in Chico. So we need local access to care. We need providers that will accept Medi-Cal. I know we've got the clinic. I spoke to somebody at Tractor Supply the other day, and I was telling them about our quest to get more medical care up here. And he explained to me that his father-in-law was having chest pains and tried to get into the clinic and they couldn't get him in. And long story short, he ended up having to have a bypass surgery 8 months later because they didn't catch what was going on with him. He's also, this man that I met also has a wife that's pregnant, and they live up here, and they're having to drive to Enloe for her monthly appointments, and then when she has the baby, she's got to get down there. So being up on the ridge here, we need to take care of our own up here. We go all the way up to Sterling City. You know, I have kind of feared we've probably got 20,000 people between Magalia and Paradise now. I sit on my deck at my house and watch that ambulance go by every single day. And the first thing that comes to my mind is I hope they make it to the hospital in time. Because if you have a heart attack and you live up in Sterling City, you've got to get all the way to Enloe. And the ambulance going as fast as they can go, it's probably 30 minutes to get down there if they don't run into construction. And that's been another peeve of mine. We've had all this road construction up here, and I have seen ambulances have to come to a stop at the road construction and wait till they can get them through there. So if you're in that ambulance and you're having a heart attack or whatever, God help you get to the hospital. So we need local access to care. We need providers that will take the insurances up here. We do need an ER. I believe that's very important, you know, for minor things. I just read today Adventist Health put that they listed the things you go to urgent care for, very minor things. Your primary care at the clinic could handle that. The urgent care is not really an urgent care. And one of the things that came up at the meeting last year and a half ago when at the Elks when we talked to Adventist Health, I know Dr. Ahn mentioned it and some other people, there was concern about people thinking that's kind of like an ER. And so let's say you're having chest pain and your husband drives you to the hospital, drives you to the urgent care, they can't deal with you. So now your treatment's been delayed because you've gone there, you found out they can't take care of you, you're gonna have to go to Enloe anyway. So access to care is super important. I agree with you on the stats. I've been wondering if the consultants are checking with Flight Care, Enloe Flight Care, how many times they're taking patients out. We've seen accidents up there. There's nowhere for the helicopter to land except for Stifer, and that's way the heck up there. So the ambulance has got to pick up the person, drive them all the way up to Stifer Road to be helicoptered down to Enloe. So, you know, there's so many things. I wonder how many times is the ambulance going down? How many times have people not got the care they needed? You know, that's why I encouraged you, Steve, to include us, the community, because we need to hear stories like hers where her children got sick and she had to go down there, you know, to deal with that. We need those. I believe that the consultants need those stats. They need to talk to Enloe Flight Care, to the ambulance company. And I don't know for sure what hours the ambulances are keeping up here. I was told we had a 24-hour ambulance in Magalia and a 12-hour in Paradise.
9 o'clock at night.
Oh, yeah. So, I mean, there's not even enough ambulances if you had a major event. And we've had a lot. And let me tell you, where I live, I see it all up there. I see everything. Everybody's got to drive by my house to go to Magalia. So my concern is access to care, having some kind of emergency services. Like I said, I worked for Feather River. I'm very disappointed that they decided not to come back because we were a family. All of us that worked at Feather River, we were a family. And we weren't there for the pay, we were there for our community. And the hospital, Feather River, was started by community members. And that's the only way I see is getting another hospital. I've had people tell me, give up, forget it, you know, all of this. I'm not going to give up because I may be one of your first patients if you get a hospital. And I want to be sure there is a place up here for me to go if I need care and I don't have to wait 4 months to get into a specialist in Chico or whatever. So that's pretty much how I feel and what I've observed. And I think Nancy's got some good ideas too. And that's why I really wanted to encourage you. We still have physicians up here. We still, you know, the girl, Melissa, who ran the ER before is still up here. She said she would be happy to come back and run the ER again. So we have personnel, we have the patients. We just need somebody to come and invest in our community and take care of us, help take care of us. So that's it.
Thank you.
Lots of good
And-
information there.
Yes, I do want to mention the consultants are in contact with those entities. So they are looking at all of that data to really fully understand what the situation is here.
Thank you.
Second, the thought that this is a team effort and we are all in this boat together. I, like Susan, live up there across the dam. I have a chronic illness that requires treatments periodically. Instead of it just being, right here on Pence Road, it's 8 or 12 trips a year to Warville to get treatment. It's very inconvenient. There are other people who are in much worse situations than I am. So I have had some conversations with my fellow Upper Ridge residents and set up a meeting with Bob Wentz of Orville Hospital next month. I'm here sort of to hear what you all might want to take to those meetings. I did have the opportunity to speak to David and Bill in the fall. Thank you for setting that up and including our voices in that conversation to let everyone in the provider side understand that there are another 9,000 or 10,000 people north of town limits that were using the facilities that existed here in Paradise, not just the hospital itself, but all of the specialty clinics that were supported by the hospital. So, if I had a gastro issue and then Mansell was down here and he could see me at his clinic and then also provide a procedure at the hospital when the hospital existed. So we need to have some kind of an operating theater up here to facilitate all of those specialty clinics that make it, it just really improves the quality of life here when you don't have to make all those additional trips into the valley, whether it's to Enloe or Orville Hospital. So I want to say that we are very much on your team here, trying to help get providers back onto the ridge. We had, talking about somebody, from going in an ambulance from the urgent care to the hospital. We had somebody going from the ambulance from our Ampla clinic down to the hospital as well just this week. And the services that you need are just not available, and everyone here understands that. And it's a matter of expressing that to anyone who's actually willing to provide those services and say, hey, there's this tremendous patient base on the ridge, and it's only getting larger, and the needs are more and more severe. We don't know exactly what's happening at the bottom of the hill. Maybe somebody in this room can clarify that, what Adventist is trying to build down there at the bottom of Skyway, but again, that's still really inconvenient for a lot of people. We want to have it here in this community, that we are, really all one community. We're, just here to stand with you and hear what the Paradise residents have to say, so I can take that to my meeting with Orville and try to get them to provide services up here on the hill. Thank you.
Anybody else?
So if we've got nobody else, I would like to.
Let's see if there's anyone online who would like to say anything. We were going to do here first and then we only have a few people there. So is there anyone who's joining us virtually who'd like to make a comment? I think we only have 3 people there. If you do, unmute, raise your hand. I am not seeing any, so they are maybe just here listening in, and that is just fine. Okay, sorry, Steve, go ahead.
So I'd like to see if our consultants could take a moment and kind of explain what they're doing, what the objective is. I know you kind of touched on it, but maybe, who you're doing, and to some of the questions as far as, the information that you're gathering and from where, and if you could do that, we'd appreciate it.
Yeah, thank you. Yes, certainly appreciate all the comments that we've heard so far, and it's consistent with, I think we've done almost 30 hours of interviews in town back in December, and we're continuing to do some more with various people, virtually as well. All of the issues that you mentioned are ones that we're looking at. We understand there's this, huge gap between what you had and what you have now, and of course, focusing on the future is going to be important. We're gathering data from a variety of sources. The first I just mentioned was, of course, listening to each of you and hearing your perspective, which is super important. And that's, I think, what we call kind of the subjective phase, which is a big part of this. And then from the objective phase of this, the objective side, we're gathering data from a multitude of sources. There are state and national data that's available looking at healthcare resources and utilization. We're also reaching out to various healthcare organizations, including Adventist. We've talked to Enlo. We're talking to Partnership for Health, which is the major health insurance provider for Medi-Cal population. We've spoken to AMPLA. We've spoken to Paradise Medical Group. And there are a list of others that we're in various stages of speaking to and gathering data from them. And so we're trying to understand exactly where the gaps are, and most importantly, what the 5 and 10-year projections will be, what the community is going to need going forward as well. Certainly, I know we've heard many times the hospital was, a huge resource that's now gone. There has been talk about standalone emergency department. I think there's some barriers and some opportunities there that we're investigating as well. And there also are some existing resources there that I think that can be leveraged. Some of the exciting things we've heard that Enlo is starting a family medicine program. So this will be training family medicine physicians. That's a 3-year residency that they go through. And what we know about residencies is that a fair proportion of doctors that train in the area actually stay in that area. And so the hope is that we can attract some of these folks to come up to Paradise, which truly is a wonderful place to live. If I were still practicing, I would want to live there as well and practice there. So I think it's an opportunity for people to see what's there and to kind of picture themselves professionally working in that environment. And there may be ways to encourage that going forward. Bill, anything I left out that you'd like to add?
No, I think you covered pretty much all of it. The only piece I probably would also add is we are looking at the flight carrier data, so looking at the air transports, and we're looking at the ground transports. So we're looking at how often is EMS being utilized to move folks. And our goal in our data analysis is to do a 2017, so you sort of get a baseline. Then what does that look like for 2018 forward? And then that, as Dr. Yoguchi suggests, will become kind of our foundation for that 5, 10, 15-year mark looking forward. And ultimately, the goal of that is to show the providers, the healthcare providers, that this is a growing community. And your school population is a great example of that, and probably one of the best signs for us to look at and say, hey, look, this is what's grown, and the schools are bulging. And there's opportunities here for, I think I heard Chris talking about kids needing stitches. Parent, I made that one myself. And so that pediatrics, what does that look like? And things like that. I think it's also really important to keep in mind of what services are always be better at, say, an NLO or something like that. And that's going to be, say, trauma or some type of bypass surgery. We want to go to our centers of excellence, even though it may be 15 or 20 minutes further away. If I were a trauma patient on the Ridge, I want to go directly to NLO unless I could breathe or something like that, because they have a trauma surgeon there 24 hours a day just waiting for me to show up with my stupid traumatic injury that I did off-roading or whatever I was doing. And so there are certain things that are just better done in certain centers, but then there are a lot of things that can be handled at a robust urgent care or freestanding ED or other type of things, similar to the story we heard about, I didn't hear the name, the person living in Magalia that needed a UTI. Absolutely, there's no reason why it should have been that number of hours to get something that simple taken care of. It would have been just great if there had been a better option, because you didn't want to go to ED. he didn't want you there because there got 40 other people that are higher than you. So it was a horrible choice for you. I'm sorry you had to do that. So that's our goal, is to say, yeah, what can be done, and to paint a picture of what the ridge is going to look like, and hopefully that will encourage providers to want to come and build their practices there.
Oh, great, thank you. And just for the record, we definitely welcome retired medical doctors up in Paradise, and we can find a lot for you, guaranteed.
This sounds good. Spent most of my years in the big city. I think I would welcome the change.
I just want to mention, we had a couple of people join us, and we have another hand up, so I'll defer to council, and if you want to hear
Yes,
those comments. Excellent.
Come on.
Come on up.
Okay.
I wanted to note for the consultants, I forgot about this. About a year ago, the school district had us complete a survey regarding like health and wellness services on the Ridge and what the kids need for counseling and just dentistry and other things. And so I'm not sure if I'm looking at them, but they're on the screen. I'm not sure if you're aware, but they did open a health and wellness resource center in January at Pine Ridge School in Magalia, and the grand opening's happening on March 4th. And so I wonder if any of the data that was gathered there could be helpful in terms of deciding what was needed for that survey. They got a grant to kind of run this program for a handful of years, is my understanding. But I remember filling out a survey, and it was a lot about just wellness in general, but a lot of things for dentistry and other things too. So that data probably exists, and maybe you can tap into the school district for that information as well.
Thank you.
I see our consultants taking notes, so thank you for bringing that up. We had two more people. Oh, go ahead. Go ahead.
And we will, I don't believe that came up, so, but we have contact with that. Thank you.
Yes, that is Paradise Union School District.
Yes.
Unified School District. That includes Magalia?
Yes, it does.
Yes, it does, yep.
Yeah, okay, thank you.
There were two folks that came in late. The hope is if you have information you'd like to share with us or concerns about healthcare, you're welcome to come up forward and speak to us. It's an open forum, no time limits. No, tell us what you have. We want to hear it.
Good evening.
Good evening.
My name is Christine Poggi. I moved here 3 months before the fire. Oh, God, that's a horrible, that's the camera? Okay. Sorry. I moved here 3 months before the fire from La Crosse, Wisconsin. My undergraduate degree is in healthcare administration, and my master's is in business. And I'm, first of all, sorry for being late. But secondly, if there's anything I can do in any way to help our community, I would really like that. The reason I got my degree is to step up in times like this. Secondly, and I apologize if this has already been covered, but when you look at who is capable of coming up here, do they have to have hospital rights? Can they be for-profit? Can they be private? Have you discussed any of those things?
No.
No, okay. So you're just consulting on what our needs are, and then the feasibility you'll bring back to us?
Yeah, that's pretty much what their guidance is to basically what are the needs of the community currently and going out forward.
Okay, thank you very much. I appreciate your letting me talk.
All right.
Hey, my name is Steve Culleton. I'm a citizen.
And there is a time limit on you.
And I live on Forest Service Road, and I've been here since 1991. One of the things you guys said in part of your study is you're going to look at 2017 and then, and all that other stuff. One of my concerns for that is in 2017, pre-fire, when we had Feather River Hospital here, we had a number of skilled nursing facilities. I mean, a number of them. And our demographic was primarily seniors. Post-fire, we have a lot of new, younger families moving in because of the great schools and a lot of other reasons, because it's a great place to raise a family. So that's got to be part of it. You can't just take, it's apples to oranges, so I'm sure you're smart enough to be aware of all that. I'm not too worried at 80 years old about 10 years from now, because I'm just more concerned with what mortuaries are going to be here. But I'm curious about, we had the ability for a short period of time to have a standalone emergency room. I know a number of people that have had serious medical conditions and traumatic necessities, and have chosen not to go to Enloe or to Oroville Hospital, and chosen to go to UC Davis or to San Francisco, University of San Francisco. And that goes anywhere. Hospitals anywhere get a bad reputation. There was a time when people had written into their directives, do not take me if I have a heart attack to Feather River Hospital, take me to Enloe or something. I mean, so that just goes with the territory. But what are the possibilities that when you talk about they're going to spend a couple of $1 million to make the little clinic here a little bit nicer, maybe. I doubt that it's still going to be open 24 hours. I've heard all the excuses about they can't hire staff, can't hire doctors. There are people here that are former employees and are credentialed saying, give me a job, give me a place to be. We have a helipad that is being unused on the facility sitting on Pence Road. That whole facility, I wish there was a way that we could just, I've asked them, why don't you sell it to us, sell it to somebody, because it could be rehabbed and used pretty quickly. The other thing would be, is brought up, are we looking at the possibility of a micro hospital? It's a concept that's being used in a number of states, in larger urban areas, but it's one of the things out there. We understand that healthcare providers and that whole game goes to is a difficult option, especially with so many of us on Medicare and government-funded healthcare. You're going to get 50 cents on the dollar. So maybe look at micro hospitals or something like that, because if I have a heart attack, I don't want to get stuck in an ambulance on the way to. And I know they told me they have life-saving measures in the ambulance. My grandson manages he's an EMT. He told me, he says, at your age, you don't want to be resuscitated. So anyway, I hope you look into micro hospitals.
Just want to verify, micro hospitals is actually the term I'm not really familiar with, but are you thinking of critical access hospitals?
Yeah, sure.
Yeah.
Critical access, yeah, okay, like Orchard.
Yeah. And one of the deals is, I know some people work at Feather. One of the deals is, you want to have supposedly we're doing it all for God, when it's really a for-profit business. That's what it is, a big corporate entity. And so when they start prescribing things, tests and whatever, they make a whole lot of things. It's really hard right now. If I need to go see a specialist, you can't even get a referral. It's just we all need it, the young people and the old people too.
Hello, I'm Heidi Lang, and I had a couple of things I've been chewing on back there. One I wanted to highlight is that we were at one time before the fire very, very well known for our birthday place. It was something that people traveled from many, many miles away to come here to have their children. Not only was it something that was done well, but we also offered alternative services with midwifery and doula services. And I know Enloe has stepped up and filled a little bit of that gap, but I can tell you just from my circle of friends, there are a lot of people having babies up here. With the younger demographic, that could be a really, really lucrative thing to develop, even if it was just as a clinic. And then I also wanted to point out, if you haven't already connected with them, Butte Glen Medical Society is another resource locally. Yes. Okay. And then lastly, I wanted to inquire if you were looking into the viability or the potential of a Native American facility possibly being something appropriate up here, because I would reference Greenville Rancheria and Greenville Medical. They're very rural, and they offer A to Z services up there, and they're totally independent and sustainable, and they do it well.
So they're a little out of our range, but that's something to compare to or for reference. That's it. Thank you.
Thanks, Heidi.
Anybody else want to speak?
I'll just tag on to Heidi's comments one last thing, that Camp Fire destroyed approximately 20% of the county's medical capacity and removed 4% of the population. So the entire county is underserved now, and that's why you're seeing these extreme wait times at Enloe. So if somebody were to locate up here, as Heidi mentions, that would be bringing people up the hill, whether it's from Butte Valley or from Cherokee or from Durham even. Rather than going to North Chico, they might choose to come here if we had a quality facility like we used to have. So you can put that in your database and let the providers know that it wouldn't just be the people who are already up here, but people who would be seeking out the high-quality services here. Thank you.
Anybody else? Anybody online?
I want to say one more little thing.
Okay.
Your comments are awesome. I agree with him. But I forgot about the nursing homes, and that is another big need we have up here, because if you know, above the dam, we still have a lot of retired people up there. I'm noticing in Paradise now when I go to events, it's young families. I hardly know anybody anymore because my family was the hospital people and a lot of them are gone. But above the dam, it's seniors. And if you have a spouse that's got to go into a nursing home and they have to be down in Oroville or down in Chico, it's a hardship for the living spouse up here to see their family members. So that is something I totally forgot about. And as I was reading today about the other hospitals, because one thing they really focused on at the Elks Lodge when Adventist Health came to talk to us was that rural hospitals are not feasible anymore, that they're failing and all that. Like she said, Rancheria offers all these services. Colusa has a 45-bed hospital there. Gridley has a 25-bed hospital. Those are little podunk towns. And, you know, people come from all over. When we opened up the clinic here, I was part of that opening. We had people coming from all over the county to come to our clinic because we had a beautiful facility. We had providers, we had physicians, we had every specialty. We had every specialty coming to the clinic to service patients. Like someone mentioned, Dr. Mansell, he would come work at the clinic and then he had his private practice too. So not having all of that is really causing a lot of anxiety for many of us up here. And like I said, when I see that ambulance go by my house every day, that's the first thing that comes to my mind. Or if we get an accident up there. And there was one 2 years ago, there was a young man that was killed on a motorcycle up on Dogtown, and they called for the helicopter, and I listened to the scanner, and I heard the helicopter coming, and they were going to land up at the Magalia Church. And pretty soon, they're flying over, and they're flying all over, and we're trying to figure out what they're doing. They couldn't land up there because the tents and the helipad wasn't cleared. So they had to be rerouted up to Stifer. Well, by the time they got up there, the young man had already passed at the accident site. So little things like that. We had a rescue down at the river. The helicopter had to come to get the boys out of the river that drowned a couple of years ago there at Cohasset. At Koodalink. They went down to the river. And so the helicopter landed right on the top of that Serpentine Hill, you know. So not having the helipad is a big issue for us here, you know, and not having it available. And I understand the church, it's a private thing because I've talked to the fire department, Station 33, and they've gone and talked to the church about clearing that area, because what happened is that particular incident, I talked to Enloe Flight Care, the pilot made the decision not to land up there because of things that were in the way and he thought it wouldn't be safe. So he had to be rerouted up. And I was just in shock as I was listening to this. So, you know, I don't know if that's something too that can be considered, whether the helipad up at Magalia Church can be cleared and be available for use. That would be nice for residents. I know people up in Magalia that pay to have helicopter service, you know, if something happens to them. And when they heard there's no place for the helicopter, they feel like they're kind of wasting their money there. So I just wanted to add that little bit.
Okay. Anybody else? Okay, well, with that being said, I want to thank everybody online, our consultants. Thank you all for giving us the time this evening to present and give your ideas. We appreciate it, and believe me, the hospital, we know it's one of the most important things that we face here on the Ridge, so we're working really hard to get the best thing that we can that's needed so much for this community. And again, thank you so much for coming.
Yeah, I took 3 pages of notes. I just say that because there's a lot of information you passed, and we really thank you for doing that, because that's what we need to hear, is what you guys want to have here on the Ridge. Our consultants will also take that information and run with it. Please know that we want to have better health care up here, okay? That is not something that we're just thinking about. Steve and I have been working on it for several years, pushing on it, talking to different entities about it. We're going to get it. It just will take time. This is going to help us, and you guys have definitely helped us think about some things that we hadn't thought of. So we really appreciate you coming tonight. Thank you very much.
And before we leave, I want to thank Colette for giving her time to do this tonight too. So thank you, Colette.
Yeah. Yeah, we're not giving up.
What's that?
We're not giving up.